rotator cuff is actually a combination of several tendons arising from the muscles which originate from the shoulder blade. We call it the scapula. So that's the scapula or the shoulder blade, and that's a ball of the shoulder joint. So the muscles which arise from the shoulder blade attach like a cuff of tissue around the ball of the shoulder. They can be injured, sometimes with spur formation between the acromion or the tip of the shoulder blade, or sometimes that can happen with dislocations of the shoulder. But more commonly, a rotator cuff tear is a part of a natural aging process. A significant proportion of the normal population do have cuff tears in their shoulders, but all of them are not symptomatic, and hence most patients do not require any treatment. A rotator cuff tear can present with pain or weakness or even both. Depending upon the occupation or the activities of each individual or any hobby they're interested in, symptoms can be difficult to generalize. Some patients complain of pain while they're bringing the arm down from an elevated position. Sometimes it's only pain. Very rarely the tear is very massive. They can have weakness, and extremely rarely it can be mistaken for stroke because they won't be able to lift the arm at all, especially if the tear is very big and the shoulder is not able to adapt or compensate to the tear. So essentially, pain and weakness are the two common symptoms experienced by patients with a rotator cuff tear. A rotator cuff tear is diagnosed by a combination of factors. One being the clinical symptoms experienced by the patient, two, a thorough clinical examination, and imaging. The basic imaging is an ultrasound scan, but it is very subjective and operator dependent. The gold standard imaging is an MRI scan, as it can bring out more detail, the degree of retraction of the tendon, the quality of the remaining tendon, etc. So it's a combination of factors. The non-surgical treatment options in a rotator cuff tear revolve around treating the pain and the movements of the shoulder. So treatment of pain involves oral medications, and if that doesn't work, then injection of steroid is an option. However, both has to be supplemented by physiotherapy, which helps to regain the strength of the shoulder muscles. If those fail, then surgery is an option. However, surgery is more of an option in patients who had an injury which caused a tear, especially in patients who never had a shoulder problem, for example, dislocated a shoulder and then developed a tear. So that's when surgery comes in. Sometimes if there is a bony spur crushing on the tendon which is persisting and causing significant symptoms not controlled by physiotherapy or painkillers, then that is another indication for considering or at least having a discussion about surgery. Nowadays, rotator cuff surgery is undertaken through keyhole, and it's a day case procedure. The principle of the operation involves putting stitches into the torn tendon and then anchoring it into bone. The success also depends on the quality of the tendon. If the rotator cuff tendon is very strong and firm, then you can put stitches and easily anchor it onto the ball of the shoulder. In some cases, the remaining tendon may be a bit friable and it may not take stitches. Even if you put stitches, it can cheese wire through the tendon, then it becomes a problem. However, if a successful repair is undertaken, then a patient can expect to be in a sling for about 6 weeks, during which time they will have physiotherapy. Return to sport is around 3 months on an average, although it depends upon the kind of sport they're undertaking. But the overall rehab period can be around 6 to 8 months average. That's a slightly tricky question, as some cases are caused by injuries and some are not. And when it happens after injuries, like a shoulder dislocation, and if they have pain, they need to check it out by their doctors. However, a major proportion of adults who sustain shoulder dislocations do get rotator cuff tears after the injury. So it's very important for the shoulders to be assessed by a specialist after such injuries. Sometimes people have spurs, that these are small bony outgrowths at the tip of the shoulder blade from the bone called the acromion, and these can rub on the tendon for a long time and cause chronic shoulder pain, and that can secondarily give rise to a rotator cuff tear, especially if they have pain when lifting the arm. So they need to get assessed by a specialist. However, the most commonest cause of cuff tear is due to age and the natural wear and tear process. We can't prevent that. However, we can treat the symptoms that arise out of the natural aging process, but not all people require that.